Fox 5 Health News, and training for prescribing painkillers could soon be mandatory for doctors.
All right, joining us now, Dr. Doris Day, Clinical Associate Professor at NYU Medical Center. This is one of those things you hear it and you're like, well, how is this not already the deal to begin with?
Yeah. Well, doctors do get a lot of training on pretty much everything we do, and we do have continuing education as well. So it's not as if we're just thrown off into the world and just told to prescribe medications. Right. There's a lot of that goes behind it. However, an outside panel has recommended to the FDA, and the FDA has many of these panels, and they often follow their recommendations, that there's extra training for doctors who prescribe opioids on a regular basis. And it's actually a really good idea, because once you go into practice, you do have meetings and continuing education, but often you don't have courses where you're really around other doctors who prescribe things that you do and look for alternatives. And the idea here is to really increase your understanding of how much opioid you can prescribe, how many pills, other alternatives, warning signs of patients, share stories and experiences, because an estimated 19,000 people die every year from narcotic painkillers. Right. This is something we have to get ahead of.
Do you think this speaks to the idea that, like, maybe doctors are too comfortable, or they go to painkillers first when there are other options?
I think a lot of times doctors have very low tolerance for their patients' pain. We don't like our patients to be uncomfortable or in pain, so we go to something that will work. But opioids are a specific problem because every brain is at risk of addiction. And to your brain, every opioid can be heroin, might as well be heroin.
Wow.
So everybody is at risk of addiction. It's not a specific person who's at risk. Anyone who gets enough of it will ultimately become addicted to it, is the worry and the way you have to think about it. Right. So doctors really need to take this think about it very carefully. And there is a line. Some patients really do need these drugs. You don't want to withhold it and have someone in pain when they have chronic pain or they're suffering from cancer or other things that are sometimes terminal. You can't just put a line on it and say, we can only do this much, only some people can have it. You want the doctors to have that authority to decide, but also to give them better tools to make the best decisions for the patients.
Yeah. No, fair
and
enough.
Train patients as well.
Sure.
That is hard.
Sure.
Right, you get the call from your patient, you want to help them out, but
exactly.
you don't want them to get hooked on the stuff. All right, Dr. Day, we appreciate it.
Thank you
very much. All right, we are locked.